us, life can seem a little bit overwhelming at times, and it can leave a lot of people, down and sometimes emotionally unstable.
And joining us today is Susan Angel. She's here to tell us more about how life stressors can lead to depression. Welcome, Susan. It's so
Thanks
nice
for
to
being
see
here.
you again.
Good to see you guys.
So what are some of the things that can trigger like everyday depressions?
Well, people don't really think about the impact that the life stressors can have on their mood. I mean, we all get stressed out over finances sometimes, employment, family, parenting, whatever, but sometimes these things, if they're prolonged and they're ongoing, like folks who've been out of work for close to a year, just not making the mortgage payments, just those types of things, eventually there can be some chemical changes in their body which can result in a true state of depression, not just one that's going to pass by.
Yeah, so what is chemically happening to the body, specifically the brain, when people are suffering from depression?
There's changes that happen in the neurochemistry, and there's three predominant ones: serotonin, norepinephrine, and dopamine, that play an important role in mood regulation. And sometimes for folks who have maybe a genetic predisposition or have got these continued stressors going on, those levels can get off, and that's when intervention may be required.
And what are some of the most common symptoms of depression?
Sadness that won't go away, it's pretty persistent. You may even have tearful episodes. There may be changes in sleep patterns or appetite, and those are things that affect a lot of people. Also concentration, their energy is poor, and they're just not getting things done.
Yeah, so if someone finds themselves suffering from those symptoms, they can go to CNS and receive some care, but they don't have to worry about costs or anything associated with that.
Absolutely. There's a process that we do where the folks come in and they'll meet with a therapist or a nurse, and they'll sit down and kind of discuss what's going on with them. And they can assess truly whether it's a case of major depression that requires intervention. And if it does, then they may be appropriate for one of our clinical studies where a medication could assist them, with their mood. And during that time, they'll get, a physical exam, lab work, just to make sure there isn't something physically underlying their symptoms, but then hopefully get their depression on track. And a really good thing, too, about our program is that after the study is over, we just don't send you on your way. We offer follow-up care for the patients who participate in our studies, so that if they need ongoing treatment for their depression, we're able to provide that for them until we can connect them in the community.
And there's no insurance needed, and it's a free thing once you determine who qualifies and who doesn't. And also you can get a stipend as well, right?
Absolutely. We recognize the time and effort it takes for you to participate, so for the folks who do enroll, there is some compensation for their time and travel while participating in the study.
So where are you guys located, and how can somebody, if they're watching, how do they take the first step?
Yeah, we're located in the South Point area. It's kind of at the intersection of JTB and 95, around now St. Vincent South, formerly St. Luke's Hospital. But they can simply give our office a call or visit the website and set up that initial pre-screening appointment.
And it's not just for depression, you also do other clinical trials
We
as well.
certainly do. We've got a lot of different things going on right now that address both mental health, like the depression, the bipolar disorder, attention deficit disorder, but we also have a medically focused programs as well, specifically hypertension, the type 2 diabetes, which is interesting you're talking about that. We also have for irritable bowel syndrome and sexual dysfunction, as well as folks who are experiencing chronic low back pain.
Okay. All right. Well,
That
Susan.
pretty much covers it, huh?
Everything.
All right. Well, thank you for being here. We also want to thank CNS, of course, for sponsoring this segment.
And to find out if any of their trials are right for you, just call 904-281-5757 and make an appointment today for a free 30-minute evaluation session, or you can also log on to their website, cnshealthcare.com. Remember, all of their services are free and no referral or insurance is needed.